Hello, I'm Dr. Justin Grannell. I'm a family medicine provider for Beacon Medical Group Bristol in Bristol, Indiana, where we see patients for multiple reasons and for their yearly wellness exams. Today, I would like to speak with you about how to make the most out of your doctor's visits, whether it's your yearly wellness exam or knowing what medications you're actually taking, or providing us with information ahead of time about what you would like to talk about or any concerns you have. My goal as your family provider is to, first of all, develop a good relationship with you, get to know you, other family members, and have that good relationship. In addition to this, taking care of you as a whole person, understanding what you may need, and having a collaborative process throughout whatever medications or medical problems you may have, and discussing what options you may have and what you feel comfortable doing and what you feel comfortable not doing, so we can both make these decisions together. There are many important things to consider when talking with us about what you're here for. Most importantly is getting your yearly wellness and preventative screenings done. When you come for a preventative exam, it's not just to examine you, it's to go over your risks based on age and what tests, whether they're immunizations, cancer screening tests, that you may need, and decide what's best for you, which ones you would like to do and which ones you don't. And to give you a really good understanding not only about those tests, but the reason why we are recommending them and the importance of doing them to try and catch certain things early on in the process, as opposed to when they're more farther advanced. When seeing a new provider for the first time, at least for myself, and I would assume the rest of the providers as well, when you're coming from a different health system and we don't have access to those records, it's very difficult to really kind of guide us on where we should go with your care, what medications you may be taking, what tests you've had done and when. So it's very important to try and get those records ready ahead of time, immunization records, recent labs, certainly your medication list, as well as any cancer screens that you've had, whether it be for females, pap smears, for everyone, colon cancer screening, which is for everyone at 45 and older, breast cancer screens, bone densities. All those test results are very helpful if you're able to have them ahead of time when you come to your new provider. When we see you for a problem-oriented visit, and sometimes we deal with those problems at your physical as well, it is very helpful for us to know ahead of time those concerns that you may want to discuss. A lot of times before you even come in, we look in your chart and we look things up to try and prepare so we can better address those concerns. So it is definitely always helpful if you can let us know ahead of time what you're coming in for or what other concerns you have. It's also helpful if you have any questions regarding the medical conditions you're being treated for to write those down, because we see often where patients come in and they forget what questions they have, and then after they leave they end up calling because they remember once they're gone. So writing them down is very helpful so we can address those at the appointment. A question we get is, how often do you need to see your provider? And unfortunately that changes depending on which provider you're seeing, what conditions you have, and depending on the control of that particular condition, such as whether it's diabetes or blood pressure or cholesterol. If you're uncontrolled, we're probably going to make medication changes and then see you back sooner than we normally would to reassess to make sure things are improving as they hopefully would do after we make those changes. For me, I see my patients who are controlled every 6 months. And again, unless you're uncontrolled, I will see you more frequently. But we see every 6 months because depending on the medicines you're on, they may have certain effects on kidneys or electrolytes, and we may need to have blood work done prior to that 6-month follow-up, in addition to the yearly blood work we usually get at your preventative care physical. It's important for everyone to have a primary care physician. They're the ones that are going to be doing your yearly physicals and doing the screening tests and getting you to any specialist you may need to see. If you do not have one, feel free to go to beaconhealthsystem.org, and there should be a list of providers who are accepting new patients, and we even have the ability for you to schedule yourself online if you feel comfortable doing that.